Hi to everyone. I am Dr. MAURYA from Department of Orthodontics, School of Dental Sciences, Babu Banarsi Das University, Lucknow. Today I will discuss on growth and development, general principles and concepts. So in orthodontics, why to know growth and development? Because the knowledge of growth and development in orthodontics is essential for making proper diagnosis and treatment plan. Because this growth affect the treatment planning of an individual. We must know about the pattern of individual's growth, which may be vertical, horizontal, or average. They have significant role on the treatment planning. Which type of plans we should give and how to control these growth, and also to know when, where, why, and how facial growth occurs. If we know where growth is occurring, upper face, lower face, when it is maximum, when it is going to start, when there is a growth spurts, and how it grows, then we can redirect the growth or we can modify the growth. Without knowing this, if we make the treatment plan for every patient, if it is same, then there is chances of failure of treatment plan without knowing the proper information about the growth. And also, we must know about the role of genetics and environmental factors in facial growth. So first, we must know about what is growth. The various authors, they have given various definitions. Like Huxley give the definition, the self-multiplication of living substance. And according to Krugman, increase in size, change in progression, proportions, and progressive complexity. And the simple definition by Toad, an increase in size. Where Meredith defined as the entire series of sequential, anatomic, and physiologic changes that taking place from beginning of prenatal life to senility. According to Moyers, quantitative aspect of biologic development per unit of time, and change in any morphological parameter which is measurable given by Melvin Moss. And profit defined as the growth refers to an increase in size or increase in number. And development, what is development? According to Todd, the development is progress towards maturity. And according to Profit, the development refers to increasing complexity. And Morse defined as the development refers to all the naturally occurring unidirectional changes in the life of an individual from its existence as single cell to its elaboration as a multifactorial unit and terminating in death. Now, what is the difference between growth and development? Growth is anatomic and physical phenomena, whereas development is anatomic and functional phenomena. Growth is characterized by increase in physical dimension, whereas development is characterized by differentiation of functions and acquisition of functionality. Growth is usually unidirectional and development is multidirectional. Growth is increase in quantitative, whereas development is increase in qualitative. Growth is active. Growth stops after a certain age, whereas development, active growth, it continues. What is differentiation? Differentiation is a change from a generalized cell or tissue to one that is more specialized kind during development. Like mesenchymal cells differentiate into various groups according to the requirements, the area where it is formed. It may change into chondroblast, osteoblast, fibroblast. So mesenchymal cells is a generalized cell and it is converted into the more specialized cell like osteoblast, which forms the bone, chondroblast, which form the cartilage, fibroblast, which form the fibers, collagen fiber. According to Todd, growth and development, they rely on one another and under the influence are morphogenetic pattern. And threefold process works its miracle. One is self-multiplication, differentiation, and organization, each according to its own kind. And the fourth dimension is the time. Since growth of the craniofacial structure is a very complex process, so we must know about the basic tenets of growth. First is concept of normalcy. So concept of normality, it refers to that which is usually expected and which is normal to that particular area, which is ordinarily seen, which is typical. So the concept of normality must not be equated with that of ideal. Ideal is central tendency, whereas normal is range, means it differs from the central tendency. It may be more, it may be slightly less. So ideal and normals both are different terms. Next is pattern. So pattern refers to a set of proportional relationships at a given point of time and also refers change in the proportional relationship over a time. Like in figure 1, it shows the growth of girls. At 2 years, we can see that the height velocity is around 10 centimeter per year. But it changes at 5 years, it is around 6 centimeter per year. Whereas in 9 years or 11 years, there is a maximum growth. It is around 9 centimeter per year. So there is change in proportional relationship over time. In starting, there is a velocity is high, then it slightly decreases. Then again there is a certain a sudden increase in hydroblast. So this is there is a change in proportional relationship over the time. There are three girls, one is early maturer, this is average and late mature. So the pattern is same, but there occurs some variability. Pattern is same in all three. Same year growth of the boys. It's early maturer, average and late mature. So this average we can say that this is ideal. It may be normal. It is early maturer and late mature. Variability difference. Variability is deviation from the usual pattern that are expressed in terms of variability. So not all individuals show a similar way of growing. It varies from individual to individual. Like in this, first child is early maturer and it is late maturer. Here boys, it is early maturer, it is late mature. It may be affected by the various factors like hormonal factors. In some girls, menarche occurs at early, whereas in others, it occurs late. So it shows that not all individuals show a similar way of growing. Some grow earlier and some grow later. So variability in growth may be due to external influence or from the timing effect. So timing effect. So variability in growth arises in several ways. It may be from normal variation. It may be from influence of outsides and from timing effect. Like all the children undergo spurts of growth at adolescence, which is called as growth spurts. But spurts of growth occurs at different times in different individuals. In some, it occurs early, in others, it occurs late. So growth spurts are not at the same time in all the individuals. So variation in timing, it arises because of the same events that happen for different individuals at different times are viewed differently. And also the biological clock of different individuals are set differently. So there occurs variability. Rhymes of growth. According to Houghton, human growth is not a steady and uniform process, wherein all parts of the body enlarge at the same rate and increments of 1 year are not equal to that of preceding or succeeding years. This growth rank is most clearly seen in stature of body height. In diagram, in orange diagram, you can see that between 13 to 14 years, the stature velocity is 8 centimeter per year. But before this, here, suppose at the 10 years, it is 5. And 17 years, suppose it is 1 centimeter per year. So before and after means all three time periods. The growth velocity is not same. The increment before growth is spurt and after growth is spurt per year is not same. It varies. Differential growth. Human body does not grow at the same rate throughout the life. Different organ grow of different rates to different amount and at different time. So this differential growth, it can be explained by two examples: cephalocaudal gradient of growth and Scammans curve of growth. In cephalocaudal gradient of growth, there is a difference in growth rate between different regions or structure in the body when compared prenatally and postnatally. Head grow at different trends, limb and trunk, they grow at different trends, prenatally and postnatally. In postnatal growth of region of body that are away from hypophysis, they grow more rapidly and faster rate than the structure nearer to it. Means the structures which are closer to hypophysis, like facial bones, which are nearer to the hypophysis, they should grow at slow rate as compared to structures which are away from the hypophysis, like trunk and limbs. They are away from hypophysis, so they grow at faster rate. So there is an axis of increased growth extending from head towards the feet. In the structure which are closer to feet, which are away from the heads, so there is an increased growth from head to feet. Like in this diagram, in prenatal growth time, like 2 to 3 months of fetus life, the head is about 50% of total body. At 4 month fetus, the proportion of head, it becomes less. At time of birth, it is about 25 to 30%. Whereas at adult time, it occupies about 12% of total body length. It means there is change in proportions of head from fetal life to adult life due to cephalocaudal gradient of growth. Means the limb and trunk which are away from the hypophysis, they grow more rapidly and faster as compared to the structure which are nearer to the hypophysis. So these trunks and limbs, it enlarges or grow more rapidly. So its proportions change and it increases. So trunk and limbs at 2 to 3 months of fetus life, where it is 50%, it becomes at more than 85% at adult life. So at third month of intrauterine life, the head takes about 50% of the total body. At birth, the trunk and the limb, they have grown more than the head, thereby reducing the head to about 30% of body. So the growth continue with progressive reduction in relative size of head about 12% in adult. This can be also explained in this diagram, where face grow proportionality at higher rate as compared to the cranium, because this face is away from the hypophysis as compared to the cranium. So this face grow more as compared to the cranium. At birth, this cranium occupy more than 50% of the skull, and it relatively decreases to 30% of vertical length of the skull in adult due to increased growth of face. And Scammons growth curve. So different tissues and organs exhibit different pattern. Richard Scammons, he studied 4 tissue organs in body from birth to 20 years, which include general or visceral tissue, neural tissue, lymphoid tissue, and genital tissue. And they given the classical curve to explain growth pattern. So this classical curves, it covers the postnatal period from birth to 20 years of age. And these curves are general or visceral curve, also called as somatic curve, neural curve, lymphoid curve, and genital. First, general or somatic. This curve is called a general or somatic. So it consists of muscles, bones, and other organs. So this general or somatic curve is exhibit an S-shaped curve. You can see here it is a S-shaped curve, which show rapid growth from 2 to 3 years. Yeah, this curve is steep. It shows a rapid growth. Then there is from 3 to 10 years, the slope is more horizontal. Means it shows a slow phase of growth between 3 to 10 years. And after 10 years, you can see there is a sudden increase, a rapid phase of growth occurs and terminating by 80 to 20 years, where it is about 100% of growth. Means the growth is nearly completed. So you can see that there is not a same pace of growth from birth to 20 years. Initially, there is rapid growth, there is minimum growth, and then again there is a rapid growth. So this general or somatic curve, it shows the classical example of differential growth. So mandible also follow the general or somatic Next is genital curve. Genital curves includes all the genital organs. This curve shows the genital curve. Here you can see that the growth from 0 to about 12 years. There is a very slow growth in the prepubertal year from 0 to 12 years. Then you can see from 12 to 20 years. There is a rapid growth. Which is a puberty time. So at puberty time, there is a rapid growth of the genital tissue. And after which, the growth ceases gradually. Means during pubertal period, there is very slow growth, and from the and in pubertal period, there is a rapid growth. Next, neural growth. This comes to the neural. Neural growth consists of brain, spinal cord, optic nerve, and related bony parts of the skull. So development occurs earlier than any other tissue or organs, and there is no adolescent growth spurts in this neural tissue. The whole neural tissue growth about at the 6 to 7 years of age. It grows very rapidly and reaches adult size by 6 to 7 years. In this diagram, you can see that at around 6 to 7 years, it is nearly to 100% of 95% of growth at the 6 to 7 years. And after 6 to 7 years, there occurs very little growth of neural tissue. Means maximum growth of neural tissue occurs at around the age of 6 to 7 years. Next is lymphoid curve. This curve shows growth of lymphoid tissue. So lymphoid tissue consists of tonsil, thymus, adenoids, appendix, intestine, and spleen. So lymphoid tissue, it proliferates rapidly in late childhood and reaches almost 200% of adult size. And by 18 years of age, it undergoes involution, a regression in size to reach adult size. In diagram, you can see that at the age of 10 years, which is late childhood, there is 200% of growth of lymphoid tissue. And after that, there is a regression or involution of lymphoid tissue occurs, and it comes to 100% at the adult age. So this rapid growth or proliferation of lymphoid tissue is an adaptation to protect children from infection. Next is growth spurts. Growth does not take place in a steady manner in growing individuals. There are certain periods when a sudden acceleration of growth occurs in both male and female. This growth occurs due to physiological alteration in hormonal secretions. And timing of growth spurts, it varies in male and female. It occurs earlier in girls as compared to boys. Woodside classifies the growth spurts into three stages: infantile or childhood growth spurts, juvenile or mixed dentition growth spurts, pubertal or adolescent growth spurts. So infantile or childhood growth spurt, it occurs in boys at the age of 3 years, in girls at the age of 3 years. Whereas juvenile and mixed dentition growth spurts in boys at the age of 7 to 9 years and in girls 6 to 7 years. And pubertal or adolescent growth spurts in boys, it occurs at 14 to 15 years and in girls, it occurs at 11 to 12 years. This growth spurt was modified by Biot, and he classified growth spurt into two stages: prenatal and postnatal. Prenatal growth spurt occurs just before birth, whereas postnatal there are three growth spurts. One, first 1 year after birth, second in mixed dentition period, the mixed dentition growth spurt, which occurs in boys at 8 to 11 years and in girls 7 to 9 years. And prepubertal growth spurts, which occurs in boys at the age of 14 to 16 years and in girls 11 to 13 years. This graph shows the growth spurts. In girls, it takes around 12 years, and in boys, it occurs at 14 years. So it is called as peak velocity height. Means at this time, the growth is at peak. Means there is a maximum growth spurt, maximum growth rate. You can see here that it preceded in girls, which occurs at the 12 years of age, and in boys it occurs at 14 years of age. Then the clinical implication of growth spurt. We can differentiate normal or pathological growth changes, or to decide the timing of orthodontic treatment. That is whether to start treatment at the time of peak of growth or after active growth is completed. Certain orthodontic treatment are done during the growth spurt to utilize the growth, like interceptive orthodontics. Suppose patient is in class growing to class 2 malocclusions, then in growth spurts periods, we can redirect the growth. We can intercept the malocclusion at this stage. Rapid maxillary extension, it is carried out during growth spurt periods before the complete ossification of mid-palatine sutures. Myofunctional appliances, orthopedic appliances, they are given at the time of growth spurt. Whereas surgical orthodontics, these procedures are carried out after active growth. Because if we do the surgical procedures, the surgical orthodontics during growth, before growth spurts period, then the chances of relapse of these corrections, because the growths are still present. So surgical orthodontics, it will be done after completion of orthodontic treatment. Thank you.